All right, so I'm Robin Devine. If I haven't met you or you haven't attended one of the talks before, I am the owner and lead therapist at Lymph Balance Center here in Calgary. I've been a massage therapist since 2002, so 18 years going on this year. And in 2005, I started really having a lot of excitement and a lot of passion for working with the lymphatic system. And I started taking programs and courses through the Chickley Health Institute, and then after that through the Academy of Lymphatic Studies. And by doing that, I have spent a lot of time looking and studying and treating the lymphatic system in my space when I was working from home. But now I have a clinic where I have 17 staff, and we all work on the lymphatic system, and we all specialize in the lymphatic system, which is great because there is such a need for it and a great desire from the public to understand what is the lymphatic system and how we can work with it in a non-invasive way. So if you're coming to listen just to understand for your own body, that's amazing. And there's a lot of information that I can share with you here, or you can watch other talks. You're more than welcome to send questions, etc. And then additionally, what we can do is if as a therapist, if you're interested in working with the lymphatic system, there's a lot of information that you can get by attending some of the talks. You can contact the clinic and talk to one of the therapists. You can send us emails. And I also do teach for the Chickley Health Institute. So I teach level 1 and level 2 of lymph drainage therapy. And in level 2 is where we address the breast tissue, which is what we're going to talk about today. So what I'm going to do is I'm going to share my screen. I just gotta, there we go, share my screen. Here we go. All right. We don't need that. We need to see, and I apologize because this is one of the first times I've worked with this new system, so give me 1 second. All right. So normally when I do this talk, I am very lucky because at our clinic, one of the things that I was adamant about right from the very beginning was having a garment fitter. And garments, when it comes to compression, when it comes to breast support, when it comes to mastectomy wear, when it comes to prosthetics, etc., it is essential that we have the proper fit. So normally I have my lovely garment specialist and fitter, Erin. She is at the clinic with us and is a phenomenal asset that we are able to access and have clients be able to access instead of having to go to 2 different locations. So normally she's here, but she helped me create this PowerPoint. And so we do get a lot of stuff directly sent to Erin because she is the garment lady. She knows all about them. So what we're going to talk about tonight is called your lymphatic system, as well as how it addresses to the breast tissue. So here we go. So first thing we're going to do is we're going to look at the anatomy. Now this is a really basic picture that's showing you the anatomy of the breast itself, as well as more specifically the axillary lymph nodes. Now, if you haven't known a lot about the lymphatic system, there are talks that I've done that are now on YouTube that are talking about the lymphatic system in its own and a lot of detail about the lymphatic system. But what you really need to know about the lymphatic system is that it's found everywhere in your body. Anywhere where you have blood, you have lymph. So there's very few tissues in your body that doesn't have the lymphatic system. And the way the lymphatic system works is this. You have blood that's getting pushed out to all of your tissues, and in that blood, you have oxygen, you have nutrients, you have water, maybe you have hormones, a whole bunch of things that your cells need to survive every single day. At the same time, we need to take the waste products that the cells are giving off to go and process and remove them from the body. So waste products that our cells like to give off would be like carbon dioxide. We'd be looking at cellular waste. We would be looking at dead cells, fragmented cells, hormones that have been used, fats, those kinds of substances. When I went to high school, we were taught that the majority of that was pulled into the venous system and carried back to the heart, where it was then pumped out to the lungs and circulated throughout the body. What we now understand is that between 90 to 98% of all that waste product that's found in and around the tissues is actually collected by your lymphatic system. Now, some places you might read that the lymphatic system is the waste removal system, and it's not. It is a transportation system and processing system that helps our body either reuse substances that we can use again, so recycling, as well as like a water treatment plant. So we're looking for like foreign cells like viruses and bacteria and parasites. We're looking for cancer cells. We're looking for dead and fragmented cells. That's stuff that's just not good for our body and that we can't reuse. We want to make sure that that gets eliminated from the body. And so the fluid that is collected from the tissues moves through the lymphatic system towards lymph nodes. And in our lymph nodes, we have these amazing cells called lymphocytes, which are lymph cells. And their job is to attack any foreign bacteria, cells, and make sure that they're not being transported throughout the rest of the body to spread. So the lymph nodes do these amazing sort of purification, clearing, policing kind of job. And eventually all that fluid that was collected from your tissues gets brought back into your bloodstream in this amazing recycling process. And it travels to your bloodstream, and then the bloodstream moves it to your kidneys, to your lungs, to your sweat glands, to your bladder, etc. Okay? So what we're looking at on this screen is the anatomy of our axillary nodes or our armpit nodes. And so what you can see on this top right diagram is we have 3 layers. So this first layer is what we call superficial layer, closest to the skin. So right on top of layer 1 would be like where hair grows on the armpit. And then as we move deeper and deeper into what we call the armpit or the axillary pyramid is more and more nodes going deep. And so this is a very basic diagram of what happens inside the armpit. So you have nodes that are coming from the arm, we have those coming from around your chest, we have some coming from your back, and they travel up, 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 until eventually it's taking it back into the venous angle, which is where it dumps back into the bloodstream. So if you think about the fluid that would be found inside the breast tissue, now we're not talking about obviously like milk production, that's a completely different storyline. We're talking about the lymphatic fluid that is given off by the cells of your breast tissue, by the skin, by the muscles underlying the breast tissue, by the tissue around the glands, around the lobes. All that tissue has blood supply on a daily basis. So if it's getting blood, it's also giving off waste products, and those need to be processed by our lymphatics. So here is showing what actually entails breast tissue. A lot of people believe that breast tissue is just what forms the actual breast, but we can have some little extensions of mammary tissue or breast tissue that go onto the chest wall just below the breast, as well as we have this thing called an axillary tail that goes up into the armpit along and underneath your pec major muscle. So a lot of the times when women have a mastectomy, you'll notice it's not just the breast, but it's also going up into the armpit. And that's because there is mammary tissue that goes as high up into the armpit as that. Here we have structures that help support the breast. Now, a lot of things can help support the breast. The first thing that's not even mentioned on this diagram is the skin. The skin is one of the primary structures that supports and lifts the breast tissue into position. So obviously, as we age and we get older, when the elastin fibers and the structures of the skin start to stretch and unfortunately sag, that's where we see breast tissue starting to descend and becoming looser along the body. We also have ligaments that help support, very specifically Cooper's ligaments, also known as suspensory ligaments, that help sort of with the upper superior or upper aspect of the breast tissue, lifting it up. And so when we look at the lymphatics of the breast, a lot of times people will focus on what happens in between the lobules as well as around the glands. But one of the things that is most of the time missed is the lymphatics of the skin. Of all your lymphatics in your entire body, 70% of all the lymph is right underneath the skin. It's called superficial lymphatic movement and mapping. And that lymphatic fluid, think about it, if you had lots of fluid congestion in the skin, how much that stretches your fibers within the skin, how it can make the breast feel heavier and descend and feel like it's drooping. So a lot of the time, if we're able to access even just the skin of the breast tissue, it will help in it feeling lighter and with it having a little bit of a lift to it, okay? So we have lymph that drains along the surface of the skin, okay? We have lymph that's going to drain in between the lobules and in the gland of the actual breast tissue. Here you have your pec muscle, but we do have some of this fluid sitting right behind the breast, but right in front of our ribs. It's called the retromammary space, and a lot of fluid can congest just behind the breast tissue, but in front of the ribs. And that actually drains into between the ribs. So when breast tissue gets addressed for lymphatic movement, we're looking at the skin, we're looking at the gland, and we're also looking at the fluid that's hiding behind the breast tissue. So it's quite an impressive series that we're looking at. Now, the breast doesn't drain in one direction, and not all breasts drain the same. So it's very hard to say that this is exactly how your breast will drain, because there's always a twist. There's always something different that the breast will do and that the lymphatic system will do in the whole body. So most of the time we say that approximately 3/4 of the breast will drain towards your armpit, with 1/4 of your lymphatics of your breast draining towards your sternum, so the midline of your chest, so the peristernal nodes or the mammary nodes, okay? Or peristernal or internal mammary nodes, excuse me, okay? Majority of the time, that's true, but we always have exceptions to this. There's going to be times where the lymph will go down into the abdomen. There's times where it comes over to the side near your armpit and then travels up. There's no one way. It's different for every woman. I love this picture. What this picture shares and shows is how your lymphatic system, even though it's separate from the cardiovascular system from your blood, it likes to travel along the same pathways as those blood vessels. So here you can see the majority of the breast is draining towards the armpit, towards the axilla. Here's a whole bunch of those nodes that's going deep up into the armpit, into that pyramid, and traveling along these major blood vessels. And here again, from the skin, from the gland, from the retromammary space, all draining towards and along with the major blood vessels coming from the arm and going towards the arm. Additionally, we do have some lymph nodes that hide between our ribs, and that's a very safe place for them to be because our ribs are pretty solid. So those lymph nodes that are hiding between our ribs and behind our ribs are going to help drain some of the fluid from the breast as well. This is a wonderful diagram that shows a lot of times, breast tissue looks so big, and it depends on the breasts that you are looking at. But the breast tissue itself is sitting just on the front of our pectoralis major muscle. And so this is showing all the little lymphatic pathways that are possible. One of the unique pathways that happens for the breast is called the Rotter's nodes. And Rotter's nodes are located between your pec major and your pec minor muscles. And there are some that take a lot of fluid from the breast tissue and drain it up towards the blood vessels and the nodes along the subclavian vein. But again, here's the major big pathways that are carrying lymph towards our armpit. Here's some pathways that are going towards those peristernal or internal mammary nodes. But look, there are some pathways that maybe cross along the midline. And here's some that maybe are coming down. Every person is so unique. And this is where I love the Chickley Health Institute and their version of lymphatic work, which is called lymph drainage therapy, because it's all about palpating. It's assuming that you can't assume what the body's going to do. And no matter how many textbooks you read, No matter how many people you work on, there's always something new to learn from each body. And as you're working with each patient, you learn that their body is unique. And through the scars and the traumas and the history of that individual will change the way their lymph moves. It will find new pathways, it'll find new directions. So one of the skills that I'm most proud of, that I love using day in, day out, is the capacity of doing lymphatic mapping. And lymphatic mapping is all about feeling the lymph, finding the directions that it moves, and working with the uniqueness that is the lymphatic pathway of every single person. So you never assume that all the lymph or 3/4 of a lymph has to go towards the armpit, because that woman might have had scar tissue, might have had trauma, might have a lot of things that could compromise or change the way that that lymph moves. So there are a lot of things that we can help with doing lymphatic breast care, and that's what LBC stands for. So the applications of lymphatic breast care. Why would you possibly contact a therapist and say, hey, I want you to work on my breast tissue for therapeutic reasons? So the first thing is that a lot of women live with fibrocystic breasts. Now, fibrocystic breasts can be in a lot of different presentations. When you have a cyst or multiple cysts in the breast tissue, sometimes they're fluid filled and sometimes they're solid. Either way, that cyst is creating extra space and pressure on all the surrounding tissues. By doing lymphatic work, I can't necessarily reduce the size of the cyst because it is a self-enclosed structure. But what I can do is increase the drainage or the drainage of all the fluid around the cyst, creating less pressure on the cyst and therefore creating less pain within the breast tissue. For a lot of women, fibrocystic breasts are very painful, very uncomfortable, specifically in the premenstrual time frame, as well as after breastfeeding, menopause, etc. So same thing goes with non-malignant lumps. So we can have benign lumps and breast inclusions that, again, if there's a lot of fluid accumulating around it, can create a lot of discomfort in the breast tissue. So if we can encourage proper drainage and proper flow of the lymph moving out of the breast, then those lumps and those cysts are less painful. Now, the number 2 there is talking about breast pain. So this can be sometimes be known as mastenia, mastalgia, mammalgia. Basically, this is normally breast pain that is associated with menstruation. So we're looking at that premenstrual discomfort of the breast and the swelling and engorgement that happens before a cycle or even during the actual menstruating phase of a woman's cycle. So again, when we have an influx of estrogen and hormones, we see that there's more fluid accumulation in the breast tissue, more specifically on the outside of the breast along the side of the armpit. So sometimes we get less movement because of bras or tight clothing that we wear, and so that can prevent the movement of fluid, but sometimes you just create a lot of fluid in your tissues. So we do see that in that premenstrual phase where you can get quite a bit of engorgement, and we just need to assist that fluid to move. So that can be really helpful. Number 3 is talking about breastfeeding related problems. So I do a lot of lymphatic breast care for women prior to giving birth, helping with the breast tissue, making sure that it is as decongested and that the pathways are nice and open and everything's flowing really well. Because the first couple days after giving birth gets you to a point where you have such significant engorgement and you're not used to having that amount of fluid in the breast tissue. The glands produce milk, and it gets to a point where the breast tissue can feel hard. With the first real influx of milk, the breast tissue can feel rock solid and hard. It's very uncomfortable. And so we like to try and get as much lymph moving prior to giving birth as we can. But there are times where either the engorgement's quite uncomfortable and the baby's just not nursing either super effectively, doesn't have a great latch, or you can even get, blocked ducts as well. So where it says engorgement, milk stasis is just milk that's not moving. And sometimes when you have babies who are maybe premature or having troubles with latching and actually nursing, what can happen is that you get the initial milk release, but there's milk that is left over in the breast tissue that needs to be processed. And the body will generally do that on its own. Sometimes you need a little assistance and you need a little bit of treatment support. Sore nipples can be from just swelling and engorgement of the areola and the nipple itself. We definitely don't treat directly on the nipple, but what I would say is that by draining all the structures around the nipple and the areola will encourage the fluid movement from the sore tissue. Now, if there is an infection, we can't treat right away. What we want to do is we want to make sure that that tissue is treated for the infection because we don't want to spread it. So obviously, if there isn't an acute infection, which means that it's just started up, maybe have a fever, feeling not well, that's where we do need our patients to go and see doctors and get medication if that's needed. But once the medication has done its job, doing lymphatic breast care can really help move that stagnant fluid, help flush out the infection, and allow for healthy fluid to come into the breast tissue. Fissures and ulcerations where there's just not proper circulation to the breast tissue, you can start seeing some indents, some looks like cracks or lines going into the breast tissue, or even sores that start onto the breast tissue can definitely help with encouraging fluid movement and bringing fresh oxygen and nutrients to those tissues while taking away waste products. Now, one of the things I've been really surprised with in our city of Calgary, and not saying that it doesn't happen here, obviously it happens everywhere, but aesthetic lymphatic work. So initially we did have a lot of treatment that we were doing for breast reductions, but there are a lot of breast implants, breast augments. We're looking at a lot of different cosmetic surgeries. And the great part about lymphatic work is it helps reduce the appearance of the scar. It helps with that post-surgical potential for infection, but also for that post-surgical swelling. So we do treat before and after breast surgery. But what we can do is by removing the extra fluid, less likely chance of having breast drooping, which is ptosis, stretch marks, breast implants. It definitely changes the way the lymph moves, so we can help decrease the congestion around the implant and helping with the breakdown of the scar tissue. So that's really great. And one of the things that we also love to do is help our patients understand how to keep their lymphatics moving properly within their breast tissue when they're not able to get into a treatment. So there are times where we have people who travel quite far to get to our clinic because we're kind of unique in what we do. And I love being able to help individuals learn how to do their own self-care when they go home because, can't come in for a session 3 times a week unless you live close by and have a really good insurance program. So here's just a really great different diagram showing you the lymphatic fluid movement. So again, here's that 1/4 of the breast tissue draining towards those peristernal or lymph nodes along the rib and sternum. Here we have those Rotter's nodes where the fluid's traveling up, and the rest of the breast is normally going to be draining up towards the axilla or the armpit. Again, normally is a very, very broad word, and yeah, you never know where the fluid's going to move. So, all right, so self-treatment. So there's some great things that you can do to help move your own lymphatic fluid, okay? One of the first things we get every patient to learn is how to do really good diaphragmatic breathing. So I'm going to move myself back a bit so you can see me a little bit more. Let's see if I can move this down a bit. All right, so diaphragmatic breathing, one of the best ways to get your lymph moving because we have a large lymphatic vessel that brings fluid up through our abdomen and through our chest, and eventually all our lymph is trying to get to the base of our neck because that's where it dumps back into the bloodstream. So we like trying to get lymph up to this point. So if you place one hand on your chest and one hand on your abdomen, what you want to be able to do is when you take a deep breath in, you want to fill your lungs and then fill your belly. And when you breathe out, you're going to drop your belly and drop your chest. So by doing good, strong, confident, relaxed diaphragmatic breathing, what happens is not only do you change the pressure that occurs between the chest and the abdominal cavities, you're helping milk and bring that lymph back up towards the base of the neck, which is what we really want that lymph to do. Okay. Now, self-drainage to your axillas. So remember we talked at the beginning how you have all these lymph nodes in your armpit, okay? So one of the things that we can do is we can take a nice flat hand, and what you're gonna do is you can either place your hand on your head. If you go way up high, it's hard. You can't get into that armpit. It just doesn't work. So what we wanna do is we wanna have our arm relaxed. I like to sort of have my hand on my shoulder or maybe my hand on a table, okay? So that way my armpit is soft and relaxed. What I'm going to do is I'm going to take my 4 fingers and make sure they're nice flat like a paddle. We don't want to be poking in with our fingertips. That hurts like crazy. We're going to take our fingers and we're going to just allow them to act like a paddle and to push the lymph that would be in our armpit, and we're going to drain it up towards the base of our neck. So you're going to imagine it's going on a 45-degree angle. If you go straight up, you're sending the lymph into your joint, which really doesn't work. So doing that at home really won't help you either. But if you allow your hand to come in and you send, by doing a gentle compression into your armpit, you can send the lymph up towards the base of your neck. So when I go in, I'm able to send the lymph up towards my neck. So this is a great simplistic way. If all you do is diaphragmatic breathing and what we call axillary nodal pumping, that's great. By moving the lymph in your armpit, that's going to create a beautiful vacuum. And what it's going to do is it's going to start pulling fluid from your arms. A lot of times people will do this axillary nodal pumping and will feel like there's almost like little tingles going up their arms, and that's the lymph moving because you moved the lymph from your armpit towards your bloodstream. So now there's space and it brings the fluid up from your arms. Additionally, anything that drains to the armpit will now have somewhere to go. So that means along the side of your chest. It also means the breast tissue. So the breast now is going to start draining. So if all you can do is axillary node pumping, that's going to help your breast tissue. So you do 3 or 4 or 5 of these first thing in the morning when you wake up. You do them in the shower. You're going to bed, brushing your teeth. You're doing some armpits. Those are wonderful ways to just keep it as part of your routine, and that's going to help the fluid draining out from breast tissue, okay? Anytime we have stagnant fluid that is stuck, that is congesting, that you have to imagine it's like a pond that has no fresh fluid coming in and no dirty or waste products leaving, so it becomes like a little slough, like a little pond that has nothing going in and nothing leaving. And that's where you can really start getting a lot of cellular sort of unhappiness. It's where you can start having cells that start changing. That's where you can have cells that are not getting enough oxygen. If there's bacteria, if there's viruses in that tissue, it can proliferate. It can start getting bigger. It can start spreading into that tissue. We really want to encourage free-flowing lymph where it's moving, carrying waste products away so that way fresh fluid can come to that tissue. So important. Now, breast drainage, there is lots of different videos. There are lots of different follow-through sort of ways you can do it online. This is not the only way, but this is a way, okay? So one of the things, the very first picture at the top and on the left-hand side of your screen is talking about stabilizing the side by your chest, and with your other hand, you are coming up on the bottom outside of your breast tissue. So I'm going to bring my screen down a bit so you can see, okay? So being right in that position, what you're doing is you are sending the lymph up towards your armpit, which we just opened up. So we're just going to support, and we're just going to move the tissue of the breast back towards the armpit, okay? Now, when we look at the second picture, which is the top row on your right, you're going to see that the bottom hand is coming to support the bottom of the breast, And the top hand is coming up on the upside, or on the top portion of your breast, sorry. And we're going to send that fluid towards your chest. So we're just going to drain and stretch that tissue towards your sternum, sort of like towards the base of your neck. Okay. On the second row, on the left-hand side, you're going to see where we have, again, supporting the bottom of the breast, and their hands in the same position, but now instead of going towards the chest, we're now going to send lymph over towards the armpit, because again, your lymph might go more towards the armpit and maybe have none that's going towards the sternum. So we're just going to support whatever lymph movement we have. Okay. And then the last one you're seeing is a way of draining the fluid that's inside the gland as well as behind it and sending it back into the chest, because it's actually going to catch the pathways going towards in between our ribs. So with your hand on the breast tissue, what you're doing is you're going to compress it gently in towards your body. So you start out here, you compress and pump back. Okay. This is not the only way to do this. I can't emphasize this enough. If you don't like this version of doing it, that's okay. There are tons of different ways of doing self-drainage to the breast, okay? If you go and see a therapist who knows how to map your breast tissue, knows how to find your pathways, then they're able to give you very specific ways to work with your lymphatic system to drain it as effectively as possible. When you're looking on the internet and when you're doing research, that's phenomenal for the general public. And when I say general public, what I mean is nobody is officially a textbook, okay? Very few times do we see like a true textbook person where their body does all the jobs that it's supposed to do exactly how a textbook describes it. We all have uniqueness. We all have traumas. We all have surgeries, injuries, scars, whether you've had pregnancies, if you haven't, if you nursed, if you didn't, if you've had lumps removed, if you haven't, if you have cysts, if you don't, all of those things make your lymphatic system unique. So right now, being able to just sort of discuss over the internet is really hard for me to say, this is the exact protocol that you should do, because this is what's going to work for your body. This is a general way of looking at the lymphatics. If you see a lymphatic therapist and they map your breast tissue, they can give you very specific home care which is customized for your body. Okay. Now, anytime you have a scar, this is my favorite way of describing this to clients, is that your lymphatic system is like lots of little streams and creeks. And here in Calgary, we have a provincial park, which is called Fish Creek Park. And it's this beautiful park inside the city. And it's got lots of little streams and creeks, but sometimes a beaver will take up a location and will like break down trees and bring in sticks and block a creek. And by doing that, the fluid starts to build up and you see a pond. In the human body, a scar is kind of like having a beaver dam that's blocked up that pathway. And what happens is the fluid starts to build up on the other side of the scar, wherever it's trying to get to the lymphatics, to the nodes, but it can't. So these are very common scars that we see with surgical procedures in regards to breast tissue. So the first one we have is a donut scar, and that's just if they've lifted the nipple or the areola itself to do some work within the breast. The lollipop is more commonly we see the lollipop and the anchor together. So really, the lollipop can become an anchor if they do that incision underneath the breast. And sometimes we just see the crescent above. So all of these, but more specifically, the lollipop and the anchor, because of this incision that happens going down from the areola and the nipple, will actually stop fluid that maybe was trying to cross around the breast to get up to the armpit. So this can cause a back pooling of fluid. We can start seeing the inside lower portion of the breast get quite swollen, and the rest of the breast actually drains really, really well. So knowing where those scars are, by doing lymphatic work, we can help break down those scars and help the lymph find a more effective way of moving towards the nodes that it's trying to get to, even though you have these scars. Okay. So these are pictures of mastectomies, and every surgeon does a mastectomy different. I really thought it was everybody did it the same, and in my practice of 15 years doing lymphatics, I have been proven wrong. Mastectomy scars are unique to each surgeon depending on the tissue that they're trying to address, depending on the location of a tumor cell or a cancer, the actual tumor itself, if it's spread to lymph nodes, if it hasn't. And it used to be very much like this lady here on the right-hand side, where the scar would go from the sternum at the midline straight across to the armpit. And that is a very common scar that we see. What can happen is the scar can prevent fluid for the upper abdomen, lower chest from getting up to that armpit. And so we can also see that some tissue gets left, and because the scar is unforgiving or might anchor onto the rib cage, for a lot of women, it feels like a little football is hanging out underneath their armpit. Now, the picture that you see on the left, this was a combination of surgeries. This was a lumpectomy initially, which turned into a bilateral mastectomy. And this, we're starting to see more scars that are going from the inside lower portion of the breast up towards the armpit, which actually helps with lymphatic flow. But this scar, you can see a lot of swelling that is sitting below the tissue. You can see it, below the scar. Here on the inside of the scar, it's very common that with these kinds of surgeries as well, they have taken some lymph nodes, which means that the armpits are not draining in the regular fashion. So what happens in these situations where there's a mastectomy, and very specifically if lymph nodes have been removed, this is where you need to be seeing a lymphedema therapist, because a lymphedema therapist will not only map this and figure out which way your body's trying to drain, but what it will also do is a therapist will be able to redirect it and find new locations where the lymph can drain towards and prevent massive amounts of swelling. Because the more scars, it's like more beavers are taking up locations within these tissues, and the fluid keeps getting more backpiled and more backpiled, and the river that it's trying to get to has been blocked by a dam. So you just see more and more things that are preventing that fluid movement, which just leads to more issues. So definitely, if there's been any lymph nodes removed, it can't just be any therapist that plays with lymph and works with lymphatic work. It needs to be a lymphedema therapist. These are lumpectomy scars. So sometimes we see the scars right down into the tissue, which can cause a puckering and pulling down of the tissue into the thoracic or into the rib cage, and that can cause deep lymphatic movement problems. We can also see lymphatic or lumpectomy scars higher up, and depending on the size of the scar. So sometimes we're able to get the tumor out and it only needs to be like a loony size or a quarter size of a scar, and sometimes we're seeing scars that are like the length of a bill, like a dollar bill or a $5 bill if you're Canadian, because we don't have dollar bills. So this is a breast reduction. So this is that beautiful lollipop / anchor scar. So because there is that incision along the lower portion of the breast tissue, this is technically an anchor scar. The areola and the nipple have potentially been repositioned, and the breast, there has been tissue taken out. So this won't affect the way that the fluid is moving with the skin, but it does affect a lot of the times the deeper layers. Depending on if they did remove skin, and that can change the pathways of the tissue itself. But see how this scar actually goes not just to here, like the diagram, but it goes higher up. So this is where we can start to see a lot of fluid accumulating below the scar. And it just feels like you have like this beautiful football and you can't rest your arm against your body. So supportive garments and garments to avoid. So things that we don't really want to have in our lymphatic system are toxins and chemicals, etc. So unfortunately, a lot of deodorants do carry toxic chemicals, perfumes, etc., that can cause impairment into your lymphatic system. So phthalates, parabens, aluminum, triclosan. At our clinic, we only sell and bring in products that are local and that are natural for the armpit and for deodorants. And so we carry natural with clay or with baking soda or with magnesium, charcoal, etc. That's natural and that does a good job, but still not affecting the absorption into the lymphatic system. Because again, you bring it in through your skin, it gets pulled into your lymphatic system, it has an effect on your body. One of the other structures that we always look at are bras. And bras are a hot topic because nobody wants the granny bra. Nobody's sitting there going, you know, a nice beige bra. Yeah, I want it to be stretchy and I want a really thick, wide band on my shoulder. Oh, that sounds great. And yeah, I don't mind, like, you know, it doesn't have to look nice. Nobody does that. Everybody wants to walk into La Vie en Rose or into Victoria's Secret, get that sexy bra and still be perfectly supported. And it just very rarely happens. So for that reason, we also bring in lots of bras that are made by companies designed to work with women who've had either breast issues, conditions, mastectomies, lumpectomies, etc. And I'll tell you, I personally have not had a mastectomy, lumpectomy, etc., but I do wear their garments because they are so comfortable and my lymphatic system doesn't get affected. So if you have a strap that's pulling really deep into your shoulder, that is affecting your lymph flow. That's also causing a lot of muscular issues, something on another topic. But one of the things we also don't like is underwires. And I understand sometimes when you are larger chested, larger endowed, you might need that extra support, but it really should be coming more from the material of the garment as well as the structure around the chest versus underwires. Underwires are phenomenal at coming up along the outside and compressing the fluid, and the breast tissue, which is sitting here, is trying to drain up to the armpit. And there is this nice hard structure pushing really hard against your rib cage, and that can prevent a lot of fluid movement for the breast to move and drain towards the armpit. So not our favorite thing. So aside from that, we're wanting to look for healthy and supportive garments. So I don't have any other slides to show you, but what I'm going to do is I'm just going to stop the share so we can talk here for a second. When we're looking at supportive garments, what we're looking at is that the garment should fit properly. When we're looking at bras and we're looking at supportive tank tops that might have a supportive shelf, we want to make sure that the band that is coming in contact with your skin, A, doesn't leave enough of an indent that's going to cause any kind of compression. So we don't want to see a large indent because that's going to be affecting the skin of your upper abdomen from draining up towards your armpits. And that's where it wants to go traditionally. What we also don't want to see is that there's too much of a gap. So if you're wearing a bra and underneath the breast tissue, what's happening is that, I'm going to just do this so you can see a little bit better. You don't want to have a large gap here because that doesn't give your breasts any support. So we want to make sure it's a nice supportive band that goes all the way around the back. We want to see that the bands along the top are good enough that they're going to spread out the weight from the breast tissue. So you're not getting a really tight indent into the top. We want to see that you get enough support that you're feeling like you're not having to slouch over because of the weight of the breast tissue. You should be able to have your shoulders in a back position and feel supported. And whether it's from a bra that's designed to be like a sport bra, or if it's a bra that's supposed to be more of a stylish, traditional padded bra, if you're looking for like a swimsuit or you're looking for a shirt that's got a built-in, those should all give you enough support to give confidence and to give relaxed muscles and proper posture without cutting in and stopping your lymphatic flow. So that's one of the wonderful things I love doing as well, is allowing clients to come in, try on the bras and being able to physically feel their lymph and go, you know what, this bra is too tight because your lymph was moving really good, but now once you've put this bra on, the lymph is not moving. So let's try a different bra and let's fit that one on, and then let's go back and let's feel the lymph. Yep, now it's moving really, really well. So we know that a garment that you're planning on wearing every single day is giving you enough support without compromising your lymphatic system. So when we look at breast tissue and we look at the health of movement of that tissue, we need a lot of things to get to our breast tissue. We need oxygen, we need nutrients and water. There's hormones that need to get to our breast tissue. Additionally, we need to take the waste products out. So if we're constantly restricting the breast tissue and we're not getting movement, we're just allowing for congestion to settle into the tissues, which can be very heavy, uncomfortable, and sometimes really painful. So if you have congestion issues or lymphatic issues within your breast tissue, I would strongly recommend that if you can find a lymphatic therapist who's in the area that you live, that you reach out, find out if they work on breast tissue. Not all therapists feel comfortable working on breast tissue, and there are some areas of the country, of the world, that it's unacceptable to work on breast tissue. So if that's the case where you live, what you want to do is, if you can, find a lymphatic therapist when you're on travels, when you're somewhere else in the world, or do a video conference with somebody who is a lymphatic therapist and learn some of the self-drainage techniques, okay? If you can see a lymphatic therapist, I would highly recommend it. It's done very respectfully. It can be done through the sheets. It can be done through a shirt. It does not have to be skin-on-skin contact. Every individual likes and prefers and feels comfortable with something different. And so whether you want to have somebody work skin on skin, if you want somebody to work over the clothes, it doesn't make a difference. There are a lot of patients that we see where we are working with one breast has been removed because of a mastectomy, and we are doing the maintenance and trying to keep the other breast healthy and fluid moving and preventing congestion that way. So if it's something that you're considering or you're unsure of, you're more than welcome to email me. And my email address is Robin, so ROBIN, at lymphbalance.com. And Lymph Balance is LYMPH, balance.com. You can always call our clinic. It's 403-472-3100, or you can visit our website, which is www.lymphbalance.com. So we do try to do as many talks as we can about the lymphatic system and about ways that you can help yourself, but also those around you. If you have any questions, I would love to hear them, and we can go from there.